afternoon, everybody. We continue with our Taking Action for Your Health campaign this afternoon. The focus today is on breast cancer. There are several types of breast cancer known to scientists, and in some cases, a single breast tumor can be a combination of these breast cancer cells. Deciding what is the right treatment for you is a difficult process, and joining us this afternoon in our studios with more is Dr. Waide Weaver, who is of the Florida Cancer Specialist, a medical oncologist. Thank you so much for coming in.
It's my pleasure. Thank you for having me.
We hear so many times the experts talk about personalized medicine. What is that and why is it important?
Well, we've known for some time that all cancers are not created equal. Breast cancer, lung cancer, colon cancer. But what we're learning now is that within one type of cancer, breast cancer in this case, all breast cancers are not created equal either. There are certain cancers that have certain targets and unique characteristics, and we're trying to develop treatments that target some of those unique characteristics. And so while we may have a study looking at thousands of women with breast cancer and it works in 30%, well, why did it only work in 30%? Who are those 30%? What is unique about those patients' tumors that it responded to the prescribed therapy? And equally important, why didn't it work in the other 70%? And can we identify some targets in those 70% of patients and develop treatments that target those? And so it's not a one-size-fits-all. If you have breast cancer, you get drug A, B, and C, but rather trying to find the unique characteristics about each individual patient's cancer and developing a treatment plan that targets those.
Should a patient be worried if they kind of get that sense from the medical provider that they are getting a one-size-fits-all treatment?
Well, nowadays we're trying to, all of our treatments are evidence-based. There are medical studies that suggest for any given patient what should be prescribed. And so hopefully the physician will share with the patient the recommendations and the guidelines and the data that's behind it. Certainly there are some patients who don't want to get bogged down in this information, sort of tell me what to do, doc. But I think patients, particularly breast cancer patients, are very involved in their care. They're a very motivated group of patients, and they don't want to just show up for treatment. They want to understand why is this being done and what's the evidence behind it.
How is the genetic mapping helping physicians?
So it speaks to looking for those unique characteristics within breast cancer, trying to identify these targets, these unique targets that we can design therapies. And so it's really getting at the genetic basis of these tumors and trying to identify these unique characteristics that we can target with therapies.
The early detection is something that you all talk about all the time. I don't think we can say it enough how important those mammograms and those screenings are.
Absolutely. So early detection, it really changes outcomes. I mean, the earlier a cancer is detected universally, the better outcome the patient's going to have. We talk about stages of cancer. Many cancers are staged in different ways, and those stages are purely there as an outcome of survival. And so the earlier stage a cancer is detected and treatment has begun, the better chance of cure and survival going forward.
What about the woman who is not as worried about the screenings because there's no prior history of breast cancer in their family?
I think that's a common misconception with all cancers, that patients feel that if there's no family history of cancer, they don't need to be worried about cancer. And that's inaccurate, unfortunately. Maybe only 5 to 10% of any cancer is genetically based, inherited. Over 90% are spontaneous occurrences within a patient. And so these patients need to be motivated about screening as well.
Thank you so much for coming in. It's a pleasure to meet you. If you would like to learn more information about breast cancer and talk to the folks at the Florida Cancer Specialist programs, please visit them online at flcancer.com. And for more on Positively Tampa Bay, make sure you like me on Facebook.
Have something you want investigated? Contact us, I-Team at ABC.